I am here to give you information from my favorite book and your new Bible, Nursing Diagnosis and Care Plan. Just I am going to tell you about the lots of the nursing care plan. Care plan to be initiated and personalized within 24 hours of admission. Renew SOS every 24 hours. We are not supposed to go in the patient room and think about what to do. So that's why I'm going to show you some of the diagnosis that which is going to be help you lot. So you got ADPI. That's you have to remember. A stand for assessment. You are assessing for your patient. You are gathering information. You are doing head-to-toe assessment. You are getting input from the family. That's for the A stand. D is the diagnosis part. I am going to talk about the diagnosis part. I'm not going to talking about the medical diagnosis. Nursing diagnosis is very something different and special. E stand for planning. We are making the plan how is going to be get patient better out of the hospital, out of the treatment, come up with the scores and outcome is going to be affect the patient and going to better helping. So I stand for implementation. This is where you are going to use your nursing skill. Then things you help to learn to the patient. You made a plan to do what to outcomes with these patients. Now you are going to the put intervention. How is going to achieve this goal? I stand for implementation process all about. Last letter stand for E, which is evaluation process. This is very important. You are using all the stuff ADPI, assessing, diagnosis, implementation, goal you have set. Now we are going to say what do those intervention work for this patient, what is the outcome, goals I set for the patient. If so, awesome. It's now so rearranging some more planning to make sure this goal is supposed to be moved. Section 1 in this area is good job is going over each step individually, why we use care plan, what the what the process of the courses we have to formulate. Now just I want you to point out this nursing diagnosis is something completely different from the medical diagnosis. Medical diagnosis is something that only physician or provider information they are getting and telling. Those who are they can make medical diagnosis. Nursing diagnosis is something pretty different. Nursing is special because using that medical diagnosis, nurses is going to be come up with their own diagnosis. If we are going to take pneumonia, well, what can I do with the diagnosis patient? It's going to be great. The doctor might say, well, I'm going to diagnosis with the pneumonia. I'm going to, because I have license to do so. Nurse don't have license to make practice medicines. License have license for a skillful nursing, so she can say, well, since my patient has low saturation rates, oxygen because there is impaired gas exchange. I'm going to make oxygen available for the patient. I'm going to monitor oxygen saturation. I'm going to help these patients breathe properly. Those who the intervention nurse can do. That's help medical diagnosis from the nursing diagnosis. These care plans help nurses to make proper diagnosis. Let me show you